Functional lower body strength and stability become increasingly important after age 60 for maintaining independence and preventing falls. Today we're covering 3 essential exercises specifically designed for older adults: lateral step-ups, sit-to-stand, and step-downs with eccentric control. These exercises target key movement patterns needed for daily activities, balance, and fall prevention. When practiced consistently with proper form, they can help improve strength, stability, and confidence in movement. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have recent surgery, joint problems, balance disorders, or other health conditions. Understanding functional movement for fall prevention. Falls are leading cause of injury in adults over 65, often resulting from loss of balance during common movements like stepping sideways, standing from seated, or descending stairs. These 3 exercises address specific movement patterns with highest fall risk: lateral stepping and hip stability, sit-to-stand transitions, and controlled descent during stepping down. Strengthening these movement patterns through targeted practice can significantly reduce fall risk while improving confidence and independence. Research consistently shows that exercises targeting balance, leg strength, and functional movements reduce falls by 30 to 40% when practiced regularly. Exercise 1, Lateral Step-Ups for hip stability. The first exercise is lateral step-up, strengthening gluteus medius and hip abductors while training lateral stepping pattern. These muscles stabilize pelvis during sideways movements, support balance during direction changes, and prevent sideways falls during turning or stepping. Here's how to perform lateral step-ups safely. Position sturdy step or platform 4 to 6 inches high next to you. Stand beside step with right side facing platform. Step sideways onto platform with right foot, placing entire foot on surface. Press through right heel to lift body onto step. Bring left foot up to meet right foot on platform. Stand tall with both feet on step. Pause briefly for balance. Step down with left foot first, then right foot, returning to starting position. That completes 1 repetition. Perform 10 to 15 repetitions stepping up with right leg. Turn around and repeat 10 to 15 repetitions stepping up with left leg. Start with 1 to 2 sets per side. Rest 30 to 60 seconds between sets. Progress to 2 to 3 sets as strength improves. Important form reminders: maintain upright posture, don't lean sideways. Keep chest open and eyes forward. Press through heel of stepping leg, not toes. Move with control, avoid using momentum. Keep knee tracking over toes during movement. Use nearby support if needed for balance. Modifications: for limited strength or balance, perform standing lateral leg raises instead. Stand beside support, lift leg out to side without stepping. For progression, use slightly higher step or reduce hand support. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice improved lateral stability and balance, stronger hip stabilizers for sideways movements, better confidence during turning and direction changes, and reduced risk of sideways falls. Hip stability is crucial for safe daily movement. Exercise 2, SITTO stand for functional leg strength. The second exercise is sit-to-stand, building quadriceps, glutes, hamstrings, and core while training essential daily movement pattern. This exercise directly supports ability to rise from chairs, toilet, bed, and other seated positions independently. Here's how to perform sit-to-stand safely. Choose sturdy chair without wheels. Sit near front edge of seat. Position feet shoulder width apart, flat on floor. Engage core by gently tightening abdominal muscles. Lean slightly forward from hips, keeping back straight. Press through heels and stand up slowly using leg strength. Minimize use of hands pushing on thighs or armrests. Stand fully upright at top. Pause 1 to 2 seconds for balance. Slowly lower back down with control. Don't drop into chair. Lightly touch seat and immediately rise again, or sit briefly between repetitions. That completes 1 repetition. Start with 10 repetitions. Complete 1 to 2 sets initially. Rest 60 to 90 seconds between sets. Progress to 2 to 3 sets of 12 to 15 repetitions as strength improves. Critical form points: maintain straight back throughout, avoid excessive forward lean. Keep knees tracking over toes, don't let them collapse inward. Use leg strength primarily, minimal arm assistance. Lower with control, never drop into chair. Breathe naturally, exhale during standing phase. Modifications: for limited strength, place firm cushion on chair to reduce depth. Use chair with armrests and allow light arm assistance. For progression, cross arms over chest to eliminate arm use, or use lower chair. What to realistically expect: with regular practice 3 times per week over 8 to 12 weeks, you may notice easier standing from seated positions, stronger legs for daily activities, improved balance during transitions, and enhanced confidence and independence. Sit-to-stand strength is fundamental for autonomous living. Exercise 3, Step-Downs with Eccentric Control. The third exercise is Step-Downs with Eccentric Control, strengthening quadriceps while training controlled descent pattern. This exercise addresses common fall scenario, losing control while stepping down stairs or off curbs. Here's how to perform step-downs safely. Find sturdy step or platform 4 to 6 inches high. Stand on step with both feet near edge. Hold nearby railing or support for balance if needed. Slowly lift right foot off step. Using left leg, slowly lower right foot toward ground with control. Focus on controlling descent with left leg still on step. Don't just drop down. Allow right foot to lightly touch ground. Press through left leg to lift right foot back onto step. Return to starting position. That completes 1 repetition. Perform 10 to 15 repetitions with left leg controlling. Switch legs and repeat 10 to 15 repetitions with right leg controlling. Start with 1 to 2 sets per leg. Rest between sets. Progress to 2 to 3 sets as strength and control improve. Essential technique reminders: movement is slow and controlled, not quick. Keep torso upright, don't lean forward excessively. Control descent with leg remaining on step. Ensure knee stays aligned over toes. Use support for balance as needed throughout. This eccentric training builds quadriceps strength and neuromuscular control for safe stair descent. Modifications: for limited strength, use very low step 2 to 3 inches or practice on single stair. Hold railing or support continuously. For balance concerns, have sturdy support on both sides. For progression, use slightly higher step or reduce support once confident. What to realistically expect: with regular practice 3 times per week over 6 to 10 weeks, you may notice improved control during stair descent, stronger quadriceps for controlled lowering, better balance during stepping down movements, and enhanced confidence on stairs and uneven surfaces. Eccentric control is essential for safe descent. Creating comprehensive routine. Here's how to integrate these exercises into effective routine. Practice all 3 exercises in sequence 3 times per week. Sample complete routine: lateral step-ups, 1 to 2 sets of 10 to 15 reps per side. Rest 60 seconds. Sit to stand, 1 to 2 sets of 10 to 12 reps, rest 90 seconds. Step downs with eccentric control, 1 to 2 sets of 10 to 15 reps per leg. Complete routine takes 15 to 20 minutes. Allow at least 1 rest day between sessions for muscle recovery. These exercises can be performed together or distributed throughout day as convenient. Safety considerations for each exercise: lateral step-ups. Avoid if you have severe balance problems, recent hip surgery within past 3 months, severe hip arthritis with constant pain, or advanced Parkinson's affecting balance. Use nearby support and start with lateral leg raises if stepping is too challenging. Sit to stand. Avoid or modify if you have dizziness when standing, recent hip, knee or back surgery, severe arthritis with significant pain, or advanced joint disease. Use higher chair or allow arm assistance as needed. Step downs. Avoid if you have severe knee osteoarthritis, recent knee or hip surgery, sharp knee pain during stepping, or severe balance disorders. Use very low step and continuous support, or practice on flat ground initially. Always stop any exercise causing sharp pain, joint pain beyond mild muscle fatigue, dizziness or lightheadedness, or significant increased discomfort. General safety guidelines always use sturdy support surfaces for balance as needed. Practice on non-slip surface wearing stable footwear or non-slip socks. Keep exercise area clear of obstacles and tripping hazards. Have phone nearby in case assistance is needed. Consider exercising when someone else is home initially. Start conservatively with fewer repetitions and progress gradually. Listen to your body and modify or stop if something doesn't feel right. These exercises work best combined with regular walking as tolerated, proper nutrition supporting muscle health, adequate hydration throughout day, sufficient rest and recovery, and other healthy lifestyle practices. Realistic expectations for improvement. Functional strength and balance improvements occur gradually with consistent practice. Weeks 1 to 4, learning proper form and technique, initial mild muscle soreness which is normal, beginning to establish routine, some may notice slightly improved movement confidence. Weeks 4 to 8, exercises feeling more natural and controlled, noticeable improvements in leg strength, ability to progress repetitions or reduce support, improved ease during similar daily activities. Months 3 to 6, clear improvements in functional strength for daily tasks, better balance and stability during movements, established sustainable routine with continued progress, enhanced confidence in physical capabilities and reduced fall anxiety. The goal is gradual sustainable improvement supporting long-term independence and safety, not rapid dramatic change. Monitoring functional progress. Track progress through real-world functional improvements rather than just exercise numbers. Notice if you can stand from chairs more easily and confidently, navigate stairs with better control and less fear, turn and change direction with improved stability, perform daily activities with greater ease, and feel more confident in your movements overall. These functional improvements indicate meaningful strength and balance gains supporting your independence, safety, and quality of life. Importance of consistency. Fall prevention and functional strength maintenance require consistent practice. These exercises work by training both muscles and nervous system through repetition. Practicing 3 times per week consistently produces better long-term results than sporadic intense sessions. Missing occasional session is normal and acceptable. Simply resume routine when able. The goal is sustainable long-term practice supporting continued independence and reduced fall risk, not perfect adherence. Consistency over months and years maintains functional strength and balance supporting safe aging. Complementary practices. These exercises work best as part of comprehensive fall prevention approach including regular walking for cardiovascular health and functional mobility, balance exercises like standing on one foot, home safety modifications removing tripping hazards, proper footwear with good support and traction, vision and hearing checks ensuring sensory function. Medication review with doctor for drugs affecting balance, adequate vitamin D and calcium for bone health and strength. Training for upper body and core. Comprehensive approach addressing multiple fall risk factors provides best protection. Conclusion. These 3 exercises, lateral step-ups, sit-to-stand, and step-downs with eccentric control, provide essential functional training for fall prevention and independent living. Lateral step-ups build hip stability for sideways movements and turning. Sit-to-stand strengthens legs for essential daily transitions. Step-downs train controlled descent for safe stair use. Start at appropriate levels using all suggested modifications. Practice 3 times per week consistently. Progress gradually based on how your body responds. Use proper support for safety always. Listen to your body and stay within comfortable ranges. Combined with regular walking, home safety measures, and comprehensive fall prevention strategies, these exercises can significantly reduce fall risk while maintaining strength, balance, and confidence supporting continued independence and quality of life. Thank you for watching. For specific concerns about appropriate fall prevention exercises for your situation, consult with a physical therapist or healthcare provider for personalized assessment and guidance. Subscribe for evidence-based information on fall prevention and functional fitness for older adults, practical guidance prioritizing safety while helping you maintain independence and capability for daily living.